Welcome to another research review. I'm Dr. Jason Saunders with HBOT USA. Today we're going to talk about hyperbaric oxygen as it relates to tinnitus and neurosensory hearing loss. So we actually see this pretty often in our clinic. We get some referrals from a few local ENTs as there's been some research put out recently on alleviating the symptoms of tinnitus as well as improving the hearing in folks suffering from neurosensory hearing loss. And so the critical thing here is that while it does help both of these conditions have a pretty wide variety of etiology or cause. And so really it's going to depend on what the cause was, whether or not hyperbaric is going to help and how much hyperbaric is going to help. The issue for many of us is that we don't always know exactly what the cause is. That being said, for those being treated in our clinics, we have seen a tremendous relief in the tinnitus, as well as, for the most part, most people getting improved hearing or possibly even full resolution of the hearing loss. So I will post a few of the studies below in the links, but I do want to say that just like other neuropathies, it looks like, depending on the cause, the tinnitus and the neurosensory hearing loss are basically neuropathic or neuropathies of our acoustic nerves. And so by implementing hyperbaric oxygen, by reducing inflammation, by giving the oxygen that the body needs to heal, by improving the microcirculation around the tissue, we're able to get resolution of these symptoms. The critical piece, particularly for the neurosensory hearing loss, is timing. So it does appear that the sooner, and this is true for so many cases, the sooner you undergo the therapy when you have neurosensory hearing loss, absolutely the more responsive people seem to be. In the studies, they're looking at usually under about 40 days or 60 days. We've had a few patients that were longer than that and still had pretty good results. However, absolutely when it comes to neurosensory hearing loss, the sooner you get in, the better it is. It is also very important when you're dealing with these cases that you're able to get to the right therapy and the right pressures pretty quickly. Unlike other topics that I talk about in hyperbaric, this is one of those cases where higher pressure does seem to make a big difference. And so these cases are typically treated somewhere between 1.75 and 2.2 atmospheres. And that seems to be a critical number for people to be able to regain their hearing or to alleviate the symptoms of the tinnitus. Okay, thanks a lot. I hope that helps. Again, please feel free to subscribe to our channel, and in the comments below, if you have a topic that you'd like me to do some research or review on, please let us know. See you next time.